Hey everyone, welcome back to another episode of A Cup of Positivity. This week we have Dr Catharine Denning on the show. She's a cosmetic doctor specialising in facial aesthetics, and this episode is just jam-packed full of information regarding skincare, injectables, how to find a good practitioner, her 5-step skincare essentials, as well as some personalised questions I've received straight from you guys. There's just way too much info in this episode for me to do the intro justice, so definitely make yourself a cup of tea and just have a listen, probably with a notebook to hand. As always, I hope you enjoy the episode and don't forget to like, share and comment if so. I really look forward to hearing from you and see you soon. Hi, Dr. Catharine. Welcome to A Cup of Positivity. How are you?
I'm very well. Nice to speak to you. And thank you so much for having me on. I'm a bit excited.
Well, thanks for coming on. The first thing always is, do you have your cup of tea with you?
Oh, yeah, of course I do. I've got my wonderful cup of tea in a French bulldog mug, although it is 6:30 p.m. So I've got a non-caffeinated fruit tea for this evening.
Okay. What kind of fruits is it? Like berry fruits?
Yeah, I'm quite a fan of a berry fruit tea, actually, I have to say. I find them quite soothing. I always used to hate them, actually, and then I got into them in the last few years when I tried to cut down my caffeine intake, and now I've got really, really into them. I like having them just before I go to bed. But now I've got my very special French bulldog mug.
Oh, that's so cute.
Today.
Do you have dogs?
I've got a little French bulldog called Basil.
Yeah. Basil, how cute.
Yeah. Basil from Fawlty Towers.
Yeah. Oh, that's amazing.
He's very faulty.
Oh.
He's fab. He's got me through a lot of good times and bad times, that dog. So he's very, very special to me. But actually also the mug was given to me by my wonderful goddaughter Edie as well. So it has twofold meaning to me.
That's amazing. I love it. It's really cute. Is it just loads of bulldogs like back to back? Yeah. Oh, it's lovely.
French bulldogs. Sweet, isn't it? Yeah.
Yeah. Well, I've got so I've got a new flavour today. It's from Twist Teas, and they've gifted me like a little box full of samples. And this one's called Choffee Mint, which is like chocolate, coffee, mint flavours.
Oh, how interesting.
But now that you've said that about it's evening and I shouldn't be having coffee, I don't know if there's caffeine in this. Maybe I should have checked.
Oh.
I'll be bouncing off the walls.
Because some people actually find that they're not sensitive at all to caffeine and it doesn't affect their sleep, which I just can't imagine. I'm very sensitive to it. So if I had a cup of coffee before I went to bed, I wouldn't sleep.
Yeah. I think I'm okay. But I only tend to have coffee in the morning. So maybe.
Yes, me too.
Yeah.
Maximum 2 now. That's what I limit myself to.
Okay. Okay. Well, if we can start off with an introduction for anyone who doesn't know you, just let us know who you are and what you do.
Sure. So my name is Dr. Catharine Denning. I am what they call an aesthetic doctor, and we'll probably go into a bit more detail on that in the podcast. But I own a clinic on Wimpole Street called Clinic 1.6, and I largely specialise in cosmetic, dermatology, and injectables for mostly age prevention work, but I do a few other things as well.
So let's talk about facial. I always struggle with this word, aesthetics. Is that right?
Yes. Well done. Yeah.
Facial aesthetics. What kind of like procedures are you performing at the moment?
So I'd say the bulk of what I do, so all of it is non-surgical. Okay, so you can split the cosmetic sector into surgical and non-surgical. And generally facial aesthetics as a sector is the non-surgical side of it, really. I specialise in injectable treatments, and that is probably the bulk of the non-surgical sector in terms of cosmetic work. I do a lot of Botox, or we call them anti-wrinkle injections because Botox actually is a brand name. So anti-wrinkle injections, and I do a lot of filler work. So I use hyaluronic acid fillers to replace volume loss, for instance, and structural loss in the face as people get older, or in younger people, if they want to change elements about the way that they look, they can also be used to do that. On top of that, aesthetics also covers things like cosmetic dermatology. So That again is a little bit of a grey area as to what that is defined as, but it's largely non-medical dermatology. So while I do cover some things like acne, most of it is just purely what people wanting to look better in their skin. So things like pigmentation variation, or just generally wanting to look like they've got healthier skin or glowing skin. And for me, a lot of what I do is about skin health. So it's about advising people what types of skincare products they can be using, what in-clinic treatments they can be using to make their skin as healthy and as radiant as possible. Then you fall into the kind of energy devices sector of aesthetics, which I don't do nearly as much of. But those include things like Althera, radio frequency, things like that use kind of energy devices to plump the skin or produce collagen or give the lift, or there's lots of, or cool sculpting, which can sort of dissolve fat. But I tend not to really do so much of that. I do more of the procedural injectable treatments.
Is there a reason for that? Because they're quite popular. Obviously, Botox and fillers, I feel like at the moment is just everywhere.
Yes, yeah, it is very popular. It's interesting that you asked that. I've literally just written an article actually for I think Town and Country. I can't actually remember who I've written it for. That's terrible, isn't it? But they asked exactly that. They've asked, why is it that the particularly the injectable side of the cosmetic industry is so popular now? And I think there's a few reasons for it. In 2017, a data company did research and found that the surgical sector was worth several million, sort of, I think it was like 3.5 million or something. But the non-surgical sector of cosmetics in 5 years' time was likely to be worth several billion. So it's really overtaken the cosmetic surgical sector in the last 5 to 10 years. And there's a few reasons for that. I think firstly, the technologies and the knowledge around injectables, particularly by us medical professionals. So things like the anatomy of human aging we've just learned so much more in the last 5 years about that, which means then you can treat it in a much more bespoke and subtle way. But also the actual types of injectables we're using. In the last 5 years, the market's gone mad. And we have so much to choose from and such fantastic technologies to get very, very natural, safe results. So that's one reason. I think the second reason is that we're much more, as younger generations are much more aware of the way that they look from things like, photographs and particularly selfies, and visual-based social media platforms like the likes of Instagram, right?
Yeah.
So people are looking at themselves a lot more. And actually, since lockdown, the first lockdown happened, I've seen an infinite increase in people coming because of Zoom face, i.e. they're looking at their faces all the time. And so they're sort of, they're realizing a little bit more about what they're looking like. Maybe they're more stressed than usual. They feel like they're aging more. And so I've had a lot of people coming in purely because of that. So I think firstly, we kind of a bit more about what we look like, or taken a bit more of an interest into what we look like, but also what things can be achieved by things like injectables. So, you follow the likes of sort of Kim Kardashian or whatever, and you can see, I didn't realize that you could have, your lips injected to look like that, or your cheeks injected to look like that. So the sort of the awareness of what the scope of injectables and other devices and other treatments can do, I think, has gone up as well. But when you compare, the non-surgical to the surgical sector, actually, non-surgical now, you can do a lot of what surgery can and used to be able to do, but for a much lower percentage of the cost, and it's much safer, less downtime. So I think it's multifactorial as to why it's so popular, but I tend to see more sort of older clients, so clients that want restorative work, i.e. they've decided that they don't recognize the way that they look, or they feel like they look angry when they're not, tired when they're not. Ironically, people always think of what I do as being kind of like anti-aging. I don't really particularly like that term, because I don't think aging is not a bad thing at all. And I think the rhetoric around aging can be actually quite toxic. Rather, I much prefer to sort of, we're actually very lucky to age. People that get to being able to worry about their age are extremely privileged and extremely fortunate. There are plenty of people around the world that don't make it to an age where they are worried about the way that they're aging, to put it bluntly. But funny enough, what people come in for are the emotional attributes of aging, which is more that they look tired or they look sad or they look angry when they're not, rather than wanting to look younger. And there is actually quite a big difference in that, I think. Becoming so much more socially acceptable to seek help for things that bother people.
Yeah. Do you think, though, that with things like Instagram and, like you say, platforms that are very visual, there's so many apps and stuff now that filter your face or even like change your facial structure. Do you think then that puts pressure on, like, or maybe not pressure, but brings you more customers because people think, oh, I want to look like this person who's heavily face tuned?
Yeah. That's a really interesting question. I think that, so to answer the first bit of the question, which is, I guess what you're asking me is, do you think is there a worry around that? Absolutely. I think there is a huge worry around that, particularly with younger people, vulnerable people. I think particularly females. We, as a gender, we tend to beat ourselves up, find things that we don't like about ourselves. You know, there is a fine line definitely between sort of wanting to change the way you look to a point where actually how good is that really for your mental health?
Exactly.
And that's something that I think practitioners or doctors like myself have to be extremely wary of. It's funny, I don't tend to find that people come in with these types of photos and with these types of filters and say, this is what I want to look like. I do know that other doctors do have patients that have that, but I'm not sure if it's just because the types of patients I attract to think about what I do differently. I don't know. I'm not sure what the answer to that is. But I do know that it is a thing. Like, people do go to doctors saying, oh, in this filtered, photo, I really like the way my lips look or my cheekbones look, whatever. Can you please emulate that? There are some people where that is fine. And actually, if that's what you want, and it's a low risk, non-permanent procedure, there's part of me that thinks, well, is that a huge issue? But I think the selection of who you treat has to be really, really stringent, because what you don't want to be doing is affecting people's mental health. If they're already feeling insecure about the way that they look, actually is changing the way you look really the right thing to be doing at that stage? Often I don't think it is.
And do you think, do you think that, especially if you start doing things like Botox or fillers, let's say, in your early 20s, do you think, one, it can get addictive, and two, what are the dangers? Like, by the time I'm 40 and I've already had God knows how many procedures, what is my aging going to look like, down the line?
But two really good questions there. So in terms of, yes, getting addicted to injectable treatments, again, that's very much a personality type. Okay, so I would say that I've not really had any patients that are addicted as much as they just like the results. So for instance, with Botox, they like the result, so they come back for more. I wouldn't say that that's getting addicted, but I understand what you're saying, and I think there are definitely people that get carried away. And the thing that's dangerous is a combination of someone that constantly wants to improve themselves, so they find one fault, fix it, find another fault. That's the type of person that I think it is you've got to be extremely aware about treating these people, because actually then you are honing into a vulnerability, and they are the sort of person that will never be satisfied with the way that they look, and actually they need to be that sort of person really needs to be getting help from a psychological point of view rather than a physical point of view. I'd say that 80% of my consultations are psychological, because treating those types of people is completely, in my view, is completely unethical. There's a mental disorder called body dysmorphic disorder, and there's several criteria that you screen for with people like that, and it includes things like, do you excessively look in the mirror? Are you excessively negative about the way that you feel about the way that you look, etc., etc. And there's a whole sort of scoring system that you do, and those types of people, to treat them would be completely medically negligent, because actually what we know about those types of people is that they have deep psychological issues, and actually treating them from an aesthetic point of view can make them infinitely worse. And as a doctor, the mental health of my patients is equally important as the physical health and the sort of desired results, I guess. So I think, in answer to your question, do people get addicted to it? I think some people can. And that's why it's really important to build a really good relationship with a doctor that will be looking after your face, and being that person to say, listen, I don't feel comfortable doing anything further because either it's going to look unnatural, or I feel that you're getting carried away now, and I think maybe you need to take a step back and look at the things that you like about yourself. And that's another thing that I do with most of my patients, is that particularly, like we've said already, sort of alluded to, a lot of women beat themselves up a lot. You know, a lot of the narrative that's going on in their heads about the way that they look and feel is negative. And actually, that's a really sad thing. And if that's the driver for someone to come and see me, then that's something I want to change for them. And actually, what I tend to get people to do is say, look, I know that you're worried about this one thing on your face. Personally, I don't think it is anything to worry about, so to speak, or I think it makes part of your face individual. It's beautiful, you know, whatever. Now, I would like you to go away, and for the next 2 weeks, every morning, I want you to say 5 things you like about your face, rather than focusing on that one detail that bothers you. And if in those 2 weeks that thing is still bothering you, I want you to come back and we'll have another discussion about it. And then, you know, maybe that is then appropriate to treat it if it's something that's bothered someone for a long time. I like to think that people can feel empowered to change things if they really want to, but it has to be coming from the right place, I think.
Yeah, absolutely.
In answer to your second question, what will you look like in several years' time if you start getting treatments? Now, there is a school of thought which I think I do to some degree agree with, is that actually early treatments, like small amounts of treatments, can actually be preventative in terms of the aging process, right?
Okay.
So there have been studies done on things like anti-wrinkle injections, as an example. And there's some great twin studies which show that people that started using botulinum toxin in their late 20s aged much slower in terms of aesthetic aging, much slower than the twin that didn't have any aesthetic interventions. And I think they had Botox treatments three times a year.
Okay.
So I think it was 10 years. And the results are pretty impressive, actually. They haven't dramatically changed the way that they've looked, but they definitely, you can tell, they've got fewer fine lines, they have less sagging, etc., etc. So there is definitely an argument to say that it can be preventative. Now, filler is similar. So I think a lot of people look at filler with a very negative light because for 2 reasons. Firstly, the things that they see and they notice are fillers that have been done badly.
Yeah.
So they notice people that have had unnatural results. And actually, majority of people that walk out of my clinic that have had filler, for instance, most people wouldn't be able to tell. My view is that people should walk out looking and feeling more confident, and it should just be, they should be feeling fresher, not younger, but just fresher. And the average person shouldn't be able to walk past them on the street and go, oh, what have you had done? Or even loved ones, friends, they shouldn't be saying to them, have you had work done? They should be saying, oh gosh, you look fresh at the moment, or did you sleep well, or whatever.
Yeah.
That's the sort of lens I think that is a really nice, the sort of nicer side of this industry. There are people that obviously don't particularly understand the anatomy of the face, that are using the wrong product in the wrong place, and then therefore you're getting unnatural results. Actually, the majority of unnatural results, you'll need to be doing a lot of injections, a lot of filler to get those unnatural results. So it is a lot, it takes quite a lot to get those unnatural results.
Oh, right, okay.
Which I think people don't really particularly recognize. So I'd say, for a full facial treatment for someone in their sort of late 50s, as an example, that worry about lower face heaviness or jowling, that they can have up to sort of 10 mils in their face, and you shouldn't be able to notice that they've had that.
Wow. Okay.
But if put in the wrong place or the wrong product used, 10 mils, then that's sort of several well, it isn't, it's several teaspoons worth. So it's not loads in terms of, if you think of it in volume, You know, 1 ml is about a quarter of a teaspoon. So it's not, in terms of when you think of volume, it's actually not a huge amount. But I think the other issue is that up until sort of, like I said, about 5-10 years ago, the types of things that we were using to revolumize the face were either semi-permanent or permanent. So things like silicons, so implants, silicon implants, calcium hydroxyapatite fillers. These are all fillers that can remain in the body for a long time. And therefore, as people age or their face changes, those permanent or semi-permanent implants don't change in the way that your face should change as it ages. So it sags, or you can see an outline of an implant, or you get those chipmunk cheeks, those horrible sort of holes, you know what I mean, in the middle of the face. Or in the cases of sort of badly done lip fillers, they have these sort of very big, pronounced, very solid looking lips that aren't in harmony, for instance, with their natural anatomy. Now that we have really good reversible hyaluronic acid fillers, you're using something, firstly, that's native to the skin. So most of the plumpness of your skin is made up of hyaluronic acid. You use it, you know, in serums to plump the skin. And that's exactly what we're injecting. So firstly, it's natural to your body. So your body breaks it down very easily, as it does your natural hyaluronic acid, into safe products that then your body naturally gets rid of. But also it means that it integrates into the tissue properly, so that it's for all intents and purposes undetectable, rather than being something that is the wrong I guess sort of material. It doesn't it stands out that from being to the skin, if you see what I mean. So there's a couple of things that have changed, particularly in the last 5 years, even, I'd say, especially with knowledge around the anatomy of the aging face. There's been a lot more research into it, and so we're understanding a lot better how to treat these things. So in sort of 20 years time, actually, if you're using things like hyaluronic acid, that, you know, you have a treatment that hyaluronic acid is no longer in the skin after 2 years.
Exactly.
It shouldn't have any negative impact on the way that you look.
So then what would you say nowadays if someone says, oh, why can't we just all age gracefully? Like, what does aging gracefully mean nowadays to you?
That's a very interesting question, that. So I think that is something that each individual person needs to define for themselves. So I think to some people, aging gracefully is not doing anything. So it's doing exactly what nature intended. Even then, you know, we know that, for instance, UVA is one of the biggest factors towards the aging process, right? So do those people feel that aging gracefully includes not using an SPF, for instance? It's a really difficult question to answer, because to one person, any intervention that's unnatural is a no. They won't dye their hair, they won't wear makeup, they won't wear SPF. They certainly won't be going down the injectables route, right? To other people, aging gracefully is, okay, I want to look myself, but I also want to look good for my age. I want to look as fresh as possible. So I'm going to cover up my grey roots. And I'm going to wear, makeup that makes my skin look dewier than it is. And I'm going to get Botox twice a year, or I am going to just replace some of that fat loss in the front of my face so that I don't look as tired. So I think it's a very personal thing. And I think the important thing is that whatever route you decide you want to go on, firstly, is that you feel comfortable with that route, and you're not, if you do decide you want to change anything about the way that you look, or you want to improve the way that you look with age, you're not doing it for anybody else but yourself, firstly. You're not trying to keep up with trends, for instance, or you're not doing it because, I don't know, the person you fancy said they thought you should look younger. Like, those are the wrong reasons to be seeking those treatments. But also, I think it needs to be done with no judgment. Because the number, you'll be amazed at the number of people that come to me that sit down in the chair and they're embarrassed to be there, not because anybody else has made them embarrassed, but they are embarrassed to be there because they were always that person that said, I'm never going to do anything to my face. I'm going to grow old gracefully. And I think actually, you know, you never know how you're going to feel. And the thing is that actually, like I said before, a lot of women come to see me because they've just lost all confidence. You know, particularly around, let's say, the perimenopause, menopause, your face actually changes significantly in quite a short space of time. And what people come to me and say is, I've stopped recognizing myself.
Wow.
Now that's a really pretty horrible thing, actually. You know, they're going through an awful lot in terms of other symptoms, often feeling very low, not sleeping very well. And then they're also not recognizing themselves. Or they say, I look like my grandmother. Which I wouldn't mind. If I look like my grandmother, I would be very happy. She's a really lovely looking lady. But I can totally understand that can really affect someone's psychology. And actually, you know, to judge someone for feeling less confident about the way that they look, and seeking treatment, actually, I think is extremely disempowering rather than empowering. And I think there's a lot of this sort of rhetoric around saying, oh, it's very anti-feminist to do any of these things. And I have to say, I think it's quite the opposite. I think if you're the one that feels empowered to go and get treatments, then absolutely do. And if you're not, then that's also great. But I think it's a very personal decision and not something that people should judge other people for.
Yeah, I agree with that. So let's say some of my listeners have decided they want to get some work done. What's the first step to finding a good practitioner? What should you be looking for?
Great question. So I think safety is the most important thing. Okay. So technically in this country, it's extremely unregulated industry, right?
Yeah.
So really you want to be making sure firstly that you see someone that is a registered medical practitioner. Now that doesn't have to be a doctor necessarily, but it does have to be someone that has what we call a registered designated body. So doctors are registered with something called the General Medical Council. Nurses are registered with the Nursing Midwifery Council. Dentists are the General Dental Council, and pharmacists also have their own governing bodies. So that's the first step, is to make sure that whoever you decide you're going to seek, you know, have a consultation with even, you want to know that they are being regulated by a higher body. And what that means is that if anything has gone wrong in the past, or they've mistreated people, or they've had serious complications, they will be brought up against their regulatory body to be struck off. So it means that you're much more likely to be seeking someone that is safe. Okay. And then within that sphere, you want to be finding people that firstly have been performing particularly injectable treatments for a long time and have a good knowledge base. Again, that can be very variable. I would say don't be afraid to ask lots of questions. So things to ask are things like, how long have you been doing this? How many treatments do you think you've performed? So, you know, I am someone, I've been doing this for over 5 years as a full-time job. I did it before then as well, but I was as a part-time, I was a surgeon in the NHS. So I did that part-time while I was doing my training. I've been doing this every single day of the week, bar some Sundays, for at least 5 years. So my caseload is huge. Okay. There are some people, let's say, that are a part-time nurse or a part-time GP, and they will only be injecting a day a week. That's also fine. But if they've only been doing that for a year, actually, how many cases could they really have covered? So I think getting an idea of how much injecting they're doing is a really important thing. Secondly, thirdly, you should feel very comfortable with them. So I think whoever you decide to choose, go and have a chat with them. Make sure you're comfortable with the relationship. Do they have the same ideals as you? Are they talking to you in a respectful way? Anybody that starts telling you have to change your face or you should change your face, absolutely walk out of that room and do not look back. Having conversations around what you would like or your expectations and things are very important.
Yeah.
And you've got to feel comfortable with that person. And if that person tries to pressure you to do treatment on that same day, again, that's actually against regulation guidelines. So I would say they're probably not the practitioner for you. They should be giving you time to go away and think about what you've discussed in that session. Okay.
Yeah.
And then make sure that they are comfortable treating any possible complications. Now, complications are extremely rare. but they can happen. And that person needs to be able to recognize firstly, and then treat them within that session. Okay, so can they treat you if you have an allergic reaction? Do they have everything on site there to treat you? Do they have everything to dissolve a filler if something goes wrong in that treatment session? Things like that, how many complications have they treated? Because again, if they've never treated a complication, the likelihood is that they're not going to be as sort of as slick or as good at treating that complication as someone that has treated complications in the past. So I think all of these things I guess the underlying thing is don't be afraid to ask questions and don't feel like you're being rude. I almost worry that people don't ask me some of these questions when they first come and see me. They sort of just assume and they go, oh, you just do what you think, doc. And it's like, no, that's not how this works. So I think that those are the first ports of call, and they should really be giving you a range of options. There is not a one-stop fix option for anything. There's always a range of options, whether that is skin treatments, you're ranging from skincare really to sort of surgery. So they should really be able to tell you this is the least invasive treatment versus the most invasive, and this is what the intermediary steps might be. And then these are the relative costs and complications.
Yeah. Just out of interest, have you ever had to fix like a botched thing from another person?
Yeah, so it's something that again is a tricky area. So a lot of practitioners won't do it, and that's partly because of insurance purposes. So a lot of people are not insured to fix other practitioners' errors, right? And the other is the medical legal aspect. So it's very difficult for someone, if you as a doctor are treating someone else's complications, do you know what filler they've used? Often not. Do you know, how much, how often, where exactly was it placed? All of these things, it becomes very difficult then to manage someone that you've not treated. Now, I do treat other people's complications as long as it's safe. So if I can find out those bits of information, and also that the patient feels that they are knowledgeable enough to kind of impart that knowledge to me, then I'm happy to treat things. But it's such a shame that even is the case, because it's expensive for that person. They've paid for a treatment with someone else that's gone wrong. They're now having to pay me to fix it. And I just think there's something, and then redo the treatment if that's what they want. It ends up being extremely expensive. So really, if you can avoid getting to see someone that might cause a complication, then that's your best thing. What I'd say is definitely do not go and see someone that's not medically trained, for instance, because firstly, they won't be able to prescribe you the medication that you need to treat any complication. And secondly, it's likely that firstly, they won't recognise exactly what it is to be able to treat it, and then obviously treat it within a time frame that means that you run into less permanent issues.
Right. Let's talk about like stuff that we can do daily to not stop, but to help with like signs of aging. Because I feel like there are so many products nowadays. And
oh my goodness, yes, I agree. It's very confusing.
Like I went to, I think, what was it? Space NK the other day with my mum, because she had a voucher that someone had given her. And we were in there for, I think, like an hour, because she was telling me about retinol, about vitamin C, about like all these different products. And I just left feeling so confused. About like sun SPF. And I just didn't have a clue where to go from there.
Yeah, no, it is. You're so right. There is just so, and also the marketing around it.
Yeah.
You sort of think, oh, I don't understand what's the difference between this one and this one, and this one's double the price. Like, where do I start? So I think it's a good question. And actually, skincare really is what everybody should be starting with. We spoke a little bit earlier about, people coming to get injectable treatments. One thing I always say to people is, it's all very well getting injectable treatments, but actually, it's a bit like going to the dentist. If you're not brushing your teeth in between those visits to the dentist, i.e. if you're not looking after your skin daily between visits to come and see me, then you're wasting your money. So skincare is the fundamental for everything. And actually, a lot of people, if they've got beautiful, glowing skin, healthy skin, often they just don't need injectable treatments. And well, you're certainly postponing the need for them, that's for sure. So yeah, raw ingredients to look out for, I think, is the best way to sort of approach skincare. So I sort of always say to people, I've got an A, B, C, D, E sort of algorithm, I guess, for people to make it a little bit easier. So the first of which is vitamin A. So you've sort of spoken a little bit about that. So retinol. Okay. So vitamin A is one of the fundamental ingredients to look out for anti-aging. And the reason for that is that we have bucket loads of data to suggest that it can not only help with sort of fine lines and resurfacing of the skin, but also can help induce collagen and elastin production. So as we get older, not only do our collagen and elastin deplete, we also get slower at making it. So vitamin A derivatives are very good at speeding up your fibroblast activity to make more collagen and elastin. So that's kind of number one. Everyone really, if you can tolerate it, should be using a retinol.
So sorry, you said vitamin A, but then you said retinol. So retinol, are they the same thing?
They are. So vitamin A is the active ingredient in a retinol. Okay, so you have lots of different levels of retinol. It becomes a little bit complicated. The active ingredient is something called retin A. And that is, if you buy it in its purest form, is actually prescription only. Okay,
right.
So it's what I prescribe people for acne, for dyschromias or like uneven pigmentation, or people that just want to have some form of aggressive skincare regime to be as anti-aging as possible, or age prevention as possible. Beneath that, you have other levels of retinol. So you have retinaldehydes, you have retinol esters. There's a whole sort of level, I guess, of, but they all get broken down in the skin into retin A, that most pure form of vitamin A. Okay, probably not the best time to go into like all the details of all the different retinols. There's plenty of information if you Google it. There's great dermatologist Angeli Marto talks about it on her Instagram. Trying to think of other great derms on Instagram and things that have broken it down. Dr. Yalda, who's a great friend of mine, has written a great post on that. No Filter Clinic London, she's written some great stuff. So yeah, there is plenty of information out there, but vitamin A is a must. Okay,
yeah.
The one thing I'd say about vitamin A is that you should be introducing it, if you don't already use it, into your skincare regime gently, because it can be a little bit irritant. Okay, and the way to use it is you cleanse your face and immediately after you put on your retinol at night. If you're using a retinol, you also should be using an SPF. So we'll go into that one in a second. So vitamin B is your AB. And there's several forms of vitamin B, but they're all fantastic for the skin. So things like niacinamide are great for redness, for increased pore size, for oily skin. It's a fantastic product to sort of calm the skin, but also hydrate. Vitamin B5 is a great hydrator. So often you'll find, so things like SkinCeuticals do a fantastic vitamin B5 serum. It's like one of the best on the market in my view. And it's particularly good if you have dry but also oily prone skin, because it's not oily, it's very light and it's very hygroscopic, so it takes on water rather than oil. It's great for people that are blemish prone, so that's a really good one. And that's also a good, the B vitamins are also good antioxidants, so they're great at protecting your skin from further damage, particularly from UV rays. Vitamin C, which everyone is like obsessed with vitamin C's, I find. It's a fantastic topical to use, but I'd say you have to be careful about which ones you use. Okay, so I would only use the form of vitamin C, this L-ascorbic acid. That is the kind of the most active form in the skin. And I would only use it if it's between 10 and 15%. Anything above 15% is irrelevant, because we know that from research it does absolutely no more to the skin than 15% does. but and you're more likely to have sort of side effects from it. The stronger it is, obviously. Anything below 10% is not worth using. So brands that I like, again, SkinCeuticals, I think do the best vitamin C. They do one that is better for pigmentation, and they do one that's better for sort of acne prone skin. So their Floritin is better for acne prone skin, and their CE Ferulic is better for sort of pigmentation. And sort of slightly drier skins. I would say that if you're acne prone, just be a little careful about using vitamin C, because it can flare up acne occasionally. But vitamin C is really good for giving you a resurfacing glow. It's good for sort of resurfacing, sort of redistributing pigmentation, but it's also one of the strongest antioxidants. So to wear that under an SPF is like kind of, I'd say you're getting the gold medal.
Okay.
if you're doing that, because again, it's mopping up free radicals that are forming from UVA damage to the skin, essentially. So it's a brilliant protector. D is defense. So again, that's kind of when you're talking about SPF. I prefer using on Caucasian, on lighter skins, I prefer people to use a mineral filter. So something that contains titanium or zinc oxide. I find that most people tolerate it better. And it also works immediately that you put it on the skin. Other chemical sunscreens, you have to do it at least a couple of hours before you go out into the UVA. So often that's just not feasible in the mornings. For darker skin types, there are some brilliant chemical filters. They're less chalky on darker skin types. So like the problem with a mineral filter is that often it leaves a kind of almost chalky residue. So I find my darker patients don't really tolerate a mineral sunscreen that well. But there are some brilliant some brilliant chemical sunscreens out there. There's been a lot of sort of fear mongering around chemical sunscreens. The amount that's absorbed into the bloodstream is absolutely minuscule, and it's certainly nothing to worry about when you compare it to the benefits that you're getting from using it. So please don't worry about using chemical filters. It's really not an issue.
Is there a minimum level of SPF that you should be using daily?
Yeah, so I'd say anything above 30, factor 30, ideally factor 50, but actually we know that the difference between the coverage of factor 30 versus factor 50 is only a couple of percent.
Right.
So, I find that most cosmeceutical companies do a really good factor 30, not that many do a good factor 50. So don't worry so much if you're not finding something that is factor 50. But I wouldn't go below a factor 30 if I could advise, and you should really be using it every single day, even in the winter.
Yeah.
Even if you're stuck in an office all day, you should be using a good SPF that's separate to your makeup.
Yeah, someone said to me that there was a cream that she was using that also has a defense against, I don't remember what it's called, but like the screen, like...
I like the blue light from the screen.
Yes. Yeah.
Yeah. So this is quite an interesting new thing that people are talking about. There isn't loads of evidence, to be completely honest, that blue light from screen affects the aging process. That doesn't mean to say that it doesn't. It's just that we don't really have loads of data to suggest that it does, right? So I would say just be a little bit cautious. There's lots of marketing ploys out there for you to spend more money. A good mineral filter or a good chemical filter should filter out irradiation from your screen anyway. I wouldn't really necessarily say that it's something that I would go out of my way to look for these sort of extra blue screen filters. It's certainly not going to affect pigmentation, as an example. I think when you're comparing the irradiation from UVA, it'll be very minimal.
Okay. And then what were we on? D. So, E.
Yeah, so D, so E, so vitamin E is another fantastic antioxidant. It's a great hydrator as well. So if you're someone that suffers from dry skin, a vitamin E is fantastic. Vitamin E is also really good for anybody that has scarring, so acne scarring or surgical scars or traumatic scars. Vitamin E is a really good one. It helps depigment and helps rebuild some of the collagen to sort of fade the appearance of scars. And it's, like we said, it's sort of a soothing antioxidant, so it's a great addition. Now listen, it sounds like you're layering loads and loads of stuff onto your skin. If you're doing all of these things now, actually the majority of good skincare ranges, a lot of these will be incorporated into one serum. So as an example, I go back to the SkinCeuticals CE Ferulic. That has vitamin C, vitamin E. It's got ferulic acid, which is a fantastic antioxidant. You know, you're combining loads in one. You can. There are plenty of really good brands that do serums that incorporate lots of those steps in there. So I wouldn't worry too much about kind of layering the raw ingredients on your skin. Otherwise, you'll go out there feeling like your skin's sort of about a mile deep. And I guess the other thing to make sure that you're doing, which is included in E, is exfoliating. So using acids that suit your skin type to exfoliate is by far the best way you can exfoliate. So I try to avoid people doing physical exfoliation. There is actually the Zedo brand that does an exfoliating polish, is the only one I ever recommend using, because it uses very fine magnesium crystals. So one, it's not bad for the environment, and two, they're very spherical. They're not going to hurt. They're not going to sort of tear or hurt the skin as much as other exfoliating beads, for example. But things like if you're blemish prone, salicylic acid is fantastic. If you have pigmentation, mandelic acid is a brilliant one to use. Alpha hydroxy acid, so things like glycolic acid, are great if you have oilier, more robust skin. If you've got quite sensitive skin, I'd look for a PHA, so a polyhydroxy acid like gluconolactone or lactobionic acid, of which Neostrata are brilliant. They've got a fantastic, the Restore range is brilliant for that. But yeah, I think going back to your original question about how you should know what to be putting on your skin, I think firstly, if you can break them down into those specific steps, then fantastic. And the other thing to bear in mind is that actually a lot of things you can buy over the counter, they can't change the function of your skin legally. Okay, so anything that changes the function of your skin technically is a drug. All right, so that then needs to be administered by a medical professional, essentially. So usually by prescription. So I probably wouldn't spend an absolute fortune on things you can buy, for instance, in Boots or in Selfridges or Harrods, because by definition, it cannot change the function of your skin. I think if you're wanting to put a bit of money aside to spend on skincare, then I would get a prescription strength skincare. You know, there are great over-the-counter things like SPF. So I love La Roche-Posay. I love Heliocare. They do some fantastic SPFs. But most prescription strength ingredients, you should really be seeing a skin specialist of some sort to advise you on what to use.
And just because you mentioned exfoliation, it just reminded me of, like, I've seen a lot of those like facial brushes, and there's just so many devices as well. Do you think devices are a bit of a fad, or are there any that you would recommend? Or
yeah, so on the whole, I'm not a huge fan of at-home devices for like you mentioned the brush of the skin. A lot of them are very aggressive. A lot of them probably will do more harm than good. Okay. The other thing to bear in mind is that every time you brush your face with an at-home skincare device, you're accumulating bacteria and bugs on that. So if you're not either changing the head of that every single time or sanitizing it properly, you know, then actually you're likely to be introducing bacteria and things onto the skin that shouldn't be there. So I think on the whole, firstly, I don't think if you're using good chemical exfoliants as an example, then you shouldn't really be needing to use these at-home devices. And secondly, often I think they're too aggressive for really what the skin you should be using on the skin anyway.
Yeah. Okay. And then I've had questions from people to ask you. So I'm going to get onto those because we're going to run out of time otherwise.
Sorry, I've been blathering on about everything.
No, I feel like, I mean, loads of my questions I've had to skip because it's just such a big topic. I wanted to ask
I can
you,
always come back on and do another session and do.
That would be really useful because I was going to ask you about hormones, but I feel like that's like a separate topic. Okay, so one question I got was most popular skincare myths that you should probably avoid.
That's a good question. Most popular skincare myths. I think we've sort of covered a lot of them. I think things like, probably my biggest bugbear is people feel the more they spend on skincare, the better the results are going to be. That annoys me because actually, like I said, a lot of over the counter skincare is just an expensive, very well marketed, nice smelling cream. And even if it does have active ingredients in it, often they're not strong enough to be doing anything really for the health of the skin. So I would say, again, just be a bit discerning about where you're spending your money. Just because something's well marketed and expensive doesn't mean it's going to be doing your skin any good. I'm not going to name names of skincare brands, but there are some extremely expensive, moisturizers for several £100s in a pot, and the active ingredients just aren't there. It's just some nice essential oils.
But you've mentioned SkinCeuticals a few times. Is that what you use, or what do you use?
I use loads of different things. Okay. For me personally, largely because I get sent lots of things to try. My skincare hero probably is Zedo, in terms of what works for my skin. I like Zedo. It's all prescription strength, and I get fantastic results from myself, but also my patients. There are hero products from things like SkinCeuticals that I really like. Like I said, things like the CE Ferulic is fantastic. I also like things like Medicate, I think do a fantastic range. But I like different things from different brands, to be honest. And I think actually often it's a little bit down to what the patient wants, how they've reacted to other skincare in the past, all these things. Skin Better Science is a fantastic range, particularly for people that haven't really entered into the realms of complicated skincare routines. And that's because I think they come at a good price point, but also they, like I said, they combine loads of steps into one or two things. So I often, for people that have never really used a skincare regime, that have fairly normal skin but just want healthier, better looking skin, that's a great starting point. And also for men who don't want like a 5-step routine in the morning and evening, you can get away with using 3 products out of their range, and I think it's a fantastic range. And it's anything that's backed by good scientific evidence. I'm happy to even if I haven't tried it myself, often, if there's really good evidence behind it, and I mean proper controlled, randomized controlled trials, not just we tried this on 7 people and most people said they like the anti-aging effect, which is what most of the marketing is around. Clinical trials. Then usually I'm happy to sort of say, well, this is what the study suggests, give it a go, you might find that this will help. So I think as long as it's a really good medical, scientific based product, I'm happy to firstly to try it, but also to recommend it often.
Yeah. Do you think that finding a good skincare regime for yourself is just trial and error? Because right now, I don't really know what I'm doing with skincare. I'm just trying some new things out.
Well, your skin looks amazing, so you're doing something right.
No, I think I'm having some hormonal issues because I've like broken out like around like my jaw area. And from what I've been reading, it's like a hormonal thing, as well as some other issues I've had with my body. So
sure.
I'm like trying to balance it out and trying to really look after my skin, but I have no idea about skincare products. So is it just
well, I think to a certain degree it is. People do respond in different ways. Personally, I find that as long as you stick to a good medical based regime for at least 6 weeks, you should see results, right? So and as long as you know what of those active ingredients you should be using, with what, in what order, at the right concentrations, the right frequencies, then really you should be trialing things for about 6 weeks, because it takes about 6 weeks for the skin cell turnover to the skin cycle to return over. So there's no point really in chopping and changing too much within that time, because firstly your skin will just get, you know, tired and sensitive to stuff. But I mean, to be honest with you, for most people that have these types of kind of, like you say, hormonal breakouts, I would definitely go and see a dermatologist that is, I'm not a dermatologist, as I've said, I'm an aesthetic doctor, but a medical dermatologist that understands and can take a full history of things like your hormonal cycles, you know, diet, exercise, all of these things, they all play a part. It's a very multifactorial problem that people find. And yes, sometimes topical skincare is the answer, but also sometimes it's not. Sometimes it is actually, I think probably you need to be trialing some systemic medications because something's out of whack here and we need to, you know, adjust for it.
Okay. Second question I got was, I've never heard of this, but someone said to ask about lip flip with Botox. Is that better than just getting fillers, and why?
Yeah. So answering that personal question to that person, I wouldn't be able to do without obviously seeing them, examining them and having a proper chat about it. But they're doing very slightly different things. Okay, so a lip flip works by softening some of the muscles around the lip so that the overriding muscle action flips the top of the lip up like this.
Oh, I see.
Okay. So what that's doing is it's rotating out the lip so that you've just got a little bit more of the existing lip on show, and then it can also just shorten this little distance between the nose and the lip here. For some people, that's very aesthetically pleasing, and it suits some people's faces, particularly if they've got a fairly sort of long distance here, or they've not got a huge amount of lip on show.
Lip, yeah.
That being said, often if that's the case, actually what they need is a little bit more volume. Okay, so a lip flip's not going to give you any more volume, although you're seeing more of the lip. It's got like from a physical point of view, it hasn't got any more volume there. You're just flipping what's already there, over. Right?
Okay.
Yeah. So lip filler works a lot more to rebuild some structure and volume in the lip. So that will not only change the appearance from the front, but it will also change the appearance from the side in terms of how far out and up a lip is projected. So and different people require different things and different techniques to treat those things. Okay, so really there's no one thing that's better than another. I guess the positives of Botox is that it wears off in 3 months or so. So if you hated it, it's gone in 3 months. The negatives is that it can affect the muscle, so it can make that muscle a bit weaker so that you can't do movements like this. So whistling, if you like to whistle, but actually more things like sucking on a straw can become a little bit harder, as an example. Yeah. So I would say really it's a personal thing, and it slightly depends on what the initial anatomy is there versus what results are wanted by the treatment.
Yeah. Okay. And then what is the best for under eye wrinkles and dark circles?
Okay, again, so it depends slightly on what's causing those things, right? So under eye wrinkles generally are to do with two things. One is that the muscle under the eye obviously is moving a lot, and the skin overlying that muscle is very closely associated with it. So as we get older and we lose collagen, that movement is just being more and more ingrained into that skin. Okay, so Botox is a fantastic treatment for fine lines and actually to prevent them getting worse. But I'm very careful about Botox around the eyes. I think it's such a shame if people can't smile with their eyes properly. Okay, so one faux pas with Botox is to have so much around the eye that your eye muscle then can't smile, for instance, in photographs. And one thing I always say to people like brides to be is like, whatever you do, don't get Botox around your eyes just before your wedding, because the likelihood is that it will change the way that your eyes smile. And that's that's such a shame. And it's what I actually personally quite like, lines around the eyes. That's a personal preference, because I think they look smiley, they look happy, they're like happy lines. And often they tell a story, which is fantastic. But I also get that lots of people hate them, and things like makeup get caught in them, and they make them feel that they look tired and crepey. Now, Botox is one option that helps to smooth out some of those lines and prevent them getting worse. If the skin quality isn't there, again, like things like retinols, vitamin C's, it's important to get the skincare right around the eyes, keeping them nice and hydrated. Around the eye tends to be less hydrated, you have less fat around the eye, and the skin is very thin. So keeping that area hydrated is really important. And getting things like injectable treatments like skin boosters can also help with sort of crepiness. So things like Profilo, or I like something called Redensity One, which is a brand that does it's hyaluronic acid injections with vitamins, essentially. In terms of under eye shadows, there's a couple of different things that can cause that. Sometimes it's pigmentation in the skin. So particularly darker ethnic skin types often get pigmentation under there, which is causing dark circles. Very difficult to treat. There are some skin cares and some lasers that can help with that. But again, I would recommend that you get examined by an aesthetic doctor or a dermatologist or an eye surgeon to sort of delineate actually what's causing that dark circle.
Okay. And then lastly, I always finish my interviews off with what I call top three. So it's just 3 questions and they're just top 3. So the first one is top 3 must-use skincare products all year round.
Okay. SPF, retinol, vitamin C.
Okay. Top 3 skincare.
Sorry, that was really boring. You've already basically discussed that.
No, it's good. Top 3 skincare brands.
I would say Zedo, SkinCeuticals, and Skin Better Science.
Okay. And then top 3 facial procedures that you could have like on a regular basis.
I would say, if it's appropriate, Botox, under eye filler, and Profilo, which is an injectable moisturizer.
Okay. So all of those 3 that you mentioned are injectables, right?
Yes. Yeah.
What about, like, should we be having like regular facials as well? Because I feel like there's like a million different types of facials as well. So
that's actually a really good question. So I would say that there's a huge variety of facials that you can get on the market. Again, I would definitely err towards spending your money on medical facials.
Okay.
And what I mean by that are seeing someone that is trained medically in skin, that understands skin anatomy, that is going to be using medical active ingredients on your skin, because it's all very nice having a nice sort of like nice smelling massage on your face. It's very relaxing and actually it gets the blood flow to the skin, but it's not going to do a huge amount else for your skin health. And it's certainly not going to be particularly preventative in terms of aging. So I'd say things like, I really like things like hydrofacial, I think is a great thing to get regularly. Things like chemical peels, microneedling, they're all changing the structure and function of the skin to improve skin health. So I'd say I would go to a medical type spa person rather than a sort of luxury, nice essential oils type facial massage if you're looking for skin health treatments.
Yeah. Okay. Awesome. Thank you so much for coming on. I feel like that was like
so lovely to chat to
so
you.
much information.
I know. I'm so sorry if that was a bit overwhelming. And
No.
I'm very happy for people to contact me on Instagram if they've got any further questions or anything needs clarifying. My Instagram handle it's Dr Denning _cosmetic _doctor.
Okay.
But yeah, you add it under the caption. It's probably,
I definitely
will
add it. Don't worry. That was the next thing I was going to ask anyways. How can people get hold of you if they want to know more? But it's been really nice having you.
That's easiest. Or I've got a website. That's lovely. Yeah, it's been lovely to speak to you. Thank you so much for having me on. I do also have a website, which is drdenning.co.uk.
Okay, perfect. Yeah, thank you so much. And I think I need to think about my skincare routine now.
Oh, bless you. Well, you've got my number, my darling. You just give me a message, whatever, if you need any help with it.
I need to get my ABCDE in check.
Yeah.
All right. Thank you so much.
Nice to touch you. Have a lovely evening.
Yeah, I'll speak to you soon.
Bye, Martha. Bye.
Bye.